This video demonstrates cardiac compressions during neonatal resuscitation. At least 5 people would be required for this complex resuscitation, but for the most part, we will focus on the 2 people doing chest compressions and ventilation. This newborn has received 30 seconds of bag and mask ventilation that moved the chest and an additional 30 seconds of PPV with a properly positioned alternative airway. The newborn's heart rate is still less than 60 beats per minute. Chest compressions are required. Several things happen at the same time. The compressor moves to the head of the infant, and the person providing PPV moves slightly to the side. The oxygen concentration is increased to 100%. If not already done, ECG leads are placed because a cardiac monitor provides the most accurate assessment of heart rate. The temperature sensor may be placed during a prolonged resuscitation to help maintain the newborn's temperature between 36.5 and 37.5 degrees Celsius. Your compression technique is critical. Place your thumbs on the sternum just below an imaginary line connecting the baby's nipples. Place your thumbs side by side or one on top of the other in the center of the sternum. Do not place your thumbs on the ribs or on the xiphoid, which is the bony projection where the lower ribs meet at the midline. Encircle the chest with your hands and place your fingers under the baby to provide support. Your fingertips do not need to touch behind the baby's back. Using your thumbs, press the sternum downward about 1/3 the anterior-posterior diameter of the chest, then release. Do not crush the baby's rib cage with your encircling hands. Allow the chest to expand during the release, but don't lift your thumbs off the chest between compressions. Compressions must be accompanied by ventilations. Each cycle of 3 compressions and 1 ventilation takes about 2 seconds. The compressor calls it out so that the person doing PPV can hear.
Breathe in 1 and 2 and 3 and breathe in 1 and 2 and 3 and breathe in.
These 2 people cannot do more tasks or talk to others. They must focus on the quality of their CPR. After 60 seconds of coordinated ventilation and compressions, continue PPV and pause compressions to assess the heart rate. It should take only a few seconds to assess the heart rate using the cardiac monitor. If the heart rate remains less than 60 beats per minute, resume compressions. When the heart rate increases to more than 60 beats per minute, stop compressions. Confirm the heart rate with auscultation and continue PPV at a rate of 40 to 60 breaths per minute. Use pulse oximetry and the target oxygen saturation table to guide oxygen concentration.